Hello, my name is Denise Amos. I'm the Associate Director for Organisational Development and Learning. Thank you everyone who's joined us in person and online. I'd like to introduce you to our CEO, Lance McCarthy, who's going to officially open This Is Us Week 2024.
Thank you, Denise. So welcome everybody to This Is Us Week 2024, a whole week full of events to recognise each other, to develop and to celebrate all the amazing things that everybody does day in, day out. There's loads and loads and loads on all through the week. Lots of formal sessions in here and online. I think almost everything's on online as well as in this room. But as well as the formal sessions, we've got our amazing Alex Health team in the room next door, room 2, all week, I think. Is that right, guys? Showcasing Alex Health and all of the benefits that we'll get for our patients and for our clinicians as well. So thank you very much. So anyone pop down anytime over the next 5 days into the room number 2. We've got exciting thing we're calling This Is Me Real, to celebrate what we do outside of work. So photographs, videos, whatever else that people are happy and comfortable to share of their lives outside of work, hobbies, etc., and then we'll showcase that throughout the course of the rest of the week to understand who we are outside of our professional environment. Coffee roulette, opportunity to meet people by complete chance and by complete random who you don't know and you don't work with in the organisation over a cup of coffee. That's running all week as well. We've got our amazing Pets as Therapy teams who are here. So for those of you who don't know, I think there's about 10 or 11 now amazing owners with very, very different dogs. Really fabulous support that they provide to our patients, but also actually to colleagues. So time to just come, have a cuddle, have a play with the dog and talk to the amazing owners who give up their time for free to support our patients. We're launching our Amazing People Awards as well. So nominations, you can understand what the awards are going to be for, an opportunity to start to think about nominating all your amazing colleagues for awards which will be presented in the autumn. And there's loads and loads and loads of giveaways, loads of prizes, loads of digital games. So a big plea, get involved as much as you possibly can. It's here for everybody. It's here for all of us to have a bit of fun, to celebrate each other. We'll learn a bit more as well. And please encourage all of your colleagues to get along as much as they possibly can. I just want to say a massive thanks at the moment to Denise and her team, because there's a lot of work and energy and effort that goes into organising this week. Massive thanks to all of the speakers internally and externally who are going to be talking through the course of the week. Big thanks to the communications team as ever for supporting this, and a massive thanks to Martin and Ian at the back who are providing audio AV and across the whole week as well. Very quickly, in terms of what's on today, I'm going to hand back to Denise, I think, in a second, but Shahid's got the first session. Thank you very much, Shahid, who's going to be sharing insights about patient personas and help us think about patient experience and how we can support our patients more effectively. We've got an hour later on, 10:45 to 11:45, where Vardini is going to be talking about robotic surgery. Now that we've got our first surgical robot here up and running, Vardini is going to be talking about that and the future of robotic surgery here at PAH. 12 o'clock till 1:30, Silpa's leading a session on factors that influence teamwork. Silpa, for those of you who don't know, is one of our lead professional nurses and midwives. Then we've got 2 o'clock. We've got the latest Daisy Award winner, which Sharon and Giuseppe are going to announce in this room. And then this afternoon, 2:45 onwards until the end of the day, we've got the Here For You team to talk about well-being and how we can support ourselves and support each other. So a fun-packed day full of things for day number 1, and then we'll talk tomorrow about days 2, 3, 4 and 5. But massive thank you for coming. Please get involved, please get engaged, please persuade your colleagues and your teams to get along and enjoy the week. Thank you.
Thank you, Lance. So we're really looking forward to a great week, and thank you for putting it together. There are so many things that you can join online, and there's so many things that you can join by being here in the LEC as well. It's all about celebrating our people, and it's all about learning as well. So I'd like to now warmly introduce Shahid, who's our Associate Director of Patient Engagement and Experience, and he's here to share insights about the important work of his team. And also, we'd like you to take this opportunity to post any questions or comments in the chat box if you're joining us online, if you're watching us on Teams. Thank you. Shahid.
Hello, morning. So I'm Shahid Sadeh, Associate Director for Patient Engagement and Experience. And so we're going to have an interactive session today. I'm sure you know that I don't let you get away with sitting there and just listening and watching. So if you look at the slides, hopefully you'll be able to see we're going to have quite a lot of different participants. So two people who are in the room on Teams are Annette Bodsworth, MBE, and Sam Fox, both Healthwatch Essex Disability Ambassadors. So Sam and Annette, I wonder if, I can't see you because I'm looking that way, but I wonder if you could introduce yourselves, Sam and Annette.
Hi, I'm Sam Fox. I'm totally blind. I'm an ambassador for Healthwatch Essex. I'm also a volunteer for the council, Essex Police, the Prosecution Service, and really just want to try and help all of you make things more accessible and workable for people who are sensory impaired. So thank you, and I look forward to speaking to you in a little while. Annette?
Good morning, everybody. It's with dual sensory loss, which means I was deaf and really sad and like that foundation and a particular is the Medical Information Standard and how we can help our path. And yes, I'm connected to the foundation.
Okay, so...
You need me?
Yes, we can just about. I think the sound is a bit patchy, but Annette, I think we got it. And as we go on, hopefully your connectivity and sound will improve. But we'll talk a little bit more in a moment. So, just to start things off, first thing I'd like you to do is just get onto menti.com. And I'm sure some of you are familiar with this, I know. Not everyone will be, but hopefully this will be one of the biggest mentees that the organisation's ever done. I want more than 100, I hope for, to participate in the Menti. We're not going to move that forward yet because I'm just getting you connected with it. And we've done introductions. So Annette Bosworth and Samantha Fox, Healthwatch Essex Disability Ambassadors, and they're going to be talking about their stories later on. The subject of today's conversation is an insight into patient personas. And what I want to do is just present the contrast between two different things, patient personas, which we are using in various different ways in our organization, and patient stories, and how both can be used. Because one of the things I spend a lot of time thinking about is how do we get our colleagues across our operational teams, across all of our teams, to understand better how they can bring the patient story into their day-to-day practice. And patient personas is one way of doing that. Patient stories is another way of doing that. So, Annette and Sam are both pretty famous. Sam, you won't be, I'm not sure you'll be able to see the slides, but I'm showing one of your newspaper articles on the BBC when COVID rules were introduced and you were interviewed about your experiences. Essentially, Annette and Sam have huge experience in the disability community and about supporting organisations with access. And one of the pieces of work they did with us is preparation for our electronic health record. So I can see the Alex Health ambassadors all through the room. You're easy to spot because you're wearing the bright yellow t-shirts. And actually they've already made a significant contribution to that. And actually there's another group of people I'll introduce. So these are our patient personas. So they were developed at the start of our time working on Alex Health, and they are Christian Ossé, Taylor Jenkinson, Harrison Zelensky, and then another one, Doris Little, who I've included from a different patient persona. And these are patients who we use the data that we have to essentially aggregate what the potential issues are which might come into our organization from. So when you look at an individual person, it gives you more of a sense of actually what's happening for a wider group of people, not just one person. So Menti, we're going to just start with some interactive activity with Menti.com. So if you scan the code, and I'll just get our Menti first step up, so just a second. Hopefully the people at the back can see this. So first question, where are you from? So this is a map where you pin the place where you're from into the map. So this is quite exciting for me because I've never used the map function in Menti. So hopefully some people will start to vote. And hopefully not all of the images will be on the United Kingdom. But we've got 2 there so far. Let's see what else appears. 3. Somebody right in the middle of Africa. Somebody from Brazil. Fantastic. Excellent. Someone just north of Indonesia. India. Fantastic. Excellent. So you know what you're doing with Menti.com. People understand how the system works. The faster people seem to have been from the United Kingdom. I don't know why that is. But yes, quite a few from different parts of the world. Fantastic. Okay, 20 people have voted so far. Excellent. So that's your first question. So just getting used to using Menti.com. Now, this is a breakfast session. So actually, I've got to ask you the question, what's your favorite breakfast? And add your name if you're feeling adventurous. So let's see what we get on the breakfast. Because this is supposed to be breakfast with. So if I ever do take you out to breakfast, then I can actually know what your breakfast cereal is. But I won't know who is wanting what. Oh no, look, there we go. Nobody's put their name yet, have they? You're not very adventurous, guys. Come on. Yogurt and granola. Bacon sandwich is winning here. Croissant, avocado on toast. A little bit more adventurous there. Porridge with honey. Pain au chocolat. Full Scottish. Where's that come from? I don't know what a full Scottish is, actually. We'll find out later. Okay. Fantastic. 26, 27, 29, 30. So I want to get that interactivity level up higher. So let's hope that we get more people scanning the code as we move along. Okay. Now, into the serious bit. Patient personas. What do you know about patient personas? And what do you think the benefits are of using a patient persona? I've kind of already given you a clue. So you can note a comment in your Menti.com. So if you type it in and let's have a look. And what we'll do is we'll compare whether or not people are picking up anything during the session and they've kind of identified what a patient persona might be used for better later on. Understanding barriers, very good. What else have we got? So we've got one response. The first one, person off the mark was understanding barriers, personalized care, consider pathways, help on updating services, identify and predict adverse outcomes, so solution is thought of ahead of time. Ooh, somebody's really thought about that one. Help articulate patient experience, represent our core patients and understand them. Personal care, cultural diversity. Excellent. Fantastic. This is going to be a resource later on, isn't it? Brilliant. Tailor care to ensure patient and staff are included in decisions about their care. Allows you to understand the needs of others through a personalized approach. Fantastic. Annette and Sam, I hope you're impressed. I am reading them out, so hopefully you can hear them. We are using them in Alex Health to help make things accessible and help communicate what's in it for me, my team, and the community we all serve. Somebody who has done a huge amount. Now, Alex Health has clearly answered that question. Robbie is in there somewhere, I suspect. Is he online? Okay. Right. So, I know I gave a huge headache to the AV team this morning, telling them, we're going to do Menti, we're going to do an audio-visual thing, and we're going to involve patients all at the same time. But amazingly, they've pulled it off. Fantastic, thank you. Okay. That's brilliant. So you're already actually really, really very close to actually the descriptions that we're going to be talking about. So understanding patient conditions and goals, developing a deeper understanding for personalized care. So what I'm hoping to do is then bring us back. I know I was told minimize your slides. I have tried to do that, and we have done this section, we have done that, we have done that. So this is an example from our EHR, and now our EHR colleagues will be very familiar with this, and actually probably all of the Alex Health Program Board will be familiar with this. But essentially, it's about aggregating data. So very often, when we look at a patient story, what we're looking at is a point in time. Just one example of one person with their one experience. What a persona allows us to do is to bring a lot of data together at the same time and actually get people to think much more deeply about what the range of possible issues are that might occur. So what you're doing is using kind of really a method which supports bringing together the statistical data. You're not just looking at an individual point in time. Because very often, one of the criticisms that are put about how do you use a patient story is it's one person. But actually, a patient persona, what it allows us to do is to bring together a group of people. So Christian's example, which is really, about using a frailty pathway, is presented here. He's insulin dependent. He's got type 2 diabetes, had a fall. We want to lower the risk of his falls, and he has got a mild cognitive impairment. All of those factors were included in work that we did on our EHR, which helped us to really work out how would we support that patient. And then again, you've got another example here, Taylor Jenkinson, maternity pathway, and some of the risk factors, which might not all come together in one person, but actually, because we're presenting a patient persona, it allows us to present all of those ideas together. And what I'm hoping is that our colleagues who are around the organization, who are watching this presentation afterwards or are watching it live, can think about, well, how could I use patient personas potentially in the work that I'm doing? And then you've got a children and young people's pathway example. And then again, we're aggregating a load of potential problems that might occur for one person, but usually they don't occur in an example that might come in. So this is someone who has had a fall, it's injured his right hand, and calls his aunt, who takes him into A&E. So hopefully that gives you a sense of patient personas and the potential value that they bring. And what I want to do is contrast that with patient stories. Now, patient stories are something we've already started to use, and Annette and Sam, what I'm showing on the screen is the report following the disabilities and EHR workshop we did together. Now, Annette will be able to describe later on when we're listening to her talk about her experience with technology. And as we all know, disabilities are massively potentially improved with the use of technology, even though a lot of the data shows that there is a digital divide. That's the reality, and we have to address that and deal with it and find ways to support access to people, for people who are not able to access digital. For people with disabilities, actually, potentially, it's of huge value. And this is one last patient persona I was going to show, which is from our cancer care services. So we brought together a group of people who were really struggling with regards to the cost of living crisis, and actually we just aggregated that data, and it's another example of a report that's available on the back of that work, and really showed actually that transport was a massive issue, and we aggregated that data with this similar patient personas used in that cancer care report. So we're going to begin with, in terms of patient stories, Sam's story. So Sam, I wonder if you could kind of join us in the room and just talk a little bit about the example that you gave me when we were preparing for this workshop. And just also say a little bit about the EHR participation that you did. So hopefully Sam is online. I don't know if she's visible.
Yes, I am.
Sam,
I am here.
off you go. Over to you.
Okay, thank you. I'm hoping that everyone can see me.
Yep.
Yeah, just so people are aware, I did mention it earlier, I am totally blind. I've only been blind for 10 years. It was on the 7th of February 2014 when I was admitted to hospital with kidney failure, and my body didn't agree with dialysis, and I ended up when I was on dialysis, I had glaucoma. I had a whole load of operations on my eyes and ended up totally blind. It's not the pathway I've chosen, I can assure you, because it's exceedingly difficult. Especially when earlier on someone was talking about barriers. Oh my goodness me, barriers are horrendous. The barriers that we face. Can I just ask you, can you all just for a moment, just shut your eyes, just to try and put yourself into my shoes for a moment. You can just shut your eyes.
Yeah, they're all shutting their eyes.
Fantastic.
Mine now as well.
Okay, if you can, right, if you want to open your eyes.
Yeah.
What I have just done, I'm going to come back because you've all just shut your eyes, and I said to put yourself into my shoes. But I tell you, it's nothing like what it's like in my shoes, because you've all just opened your eyes and been able to see what's around you. And I then had it so that you was looking at black, which is all that I can see. But even then, you can still see things around you. Now imagine 360 degrees, you cannot see a thing apart from black. So I'm totally reliant on you communicating with me. I went quiet for a little while because when you go into a room, for example, you might go and say, if you want to go and sit over there, well, where is there? I don't know where there is. But what Shahid was referring to is the importance of communication for people such as myself. Yes, I can use technology, and I do have a screen reader on my phone, but I'm relying on all of you to make sure that information is accurate. The reason I'm saying that is because I was in hospital. I was really quite unwell. I was on IV antibiotics, and I was allergic to penicillin. So I couldn't have certain medications, which is why things were getting worse, and I ended up with sepsis. Having said that, they then said, no, it's getting a bit silly. Why are you allergic to penicillin? I don't know. That's what my records say. So they tested me. I wasn't allergic to penicillin. But although the hospital had written to my GP, 6 months later I went to see my GP and he said, oh, you're allergic to penicillin? No, I'm not. I'm not allergic to penicillin. Now, thankfully, it's that way. What if it had been the other way? And I have been allergic to penicillin. And now, because someone hasn't recorded that information on my file, I'm now being given penicillin antibiotics because someone forgot to mark it on my records. That's just, you can imagine what that would have done to me. But the actual barriers that we face, that's just one small example. But, another example, and I've had numerous operations. When I come into hospital, you get taken to a ward and they get shown, this is your bed, and you get given the buzzer, here's the buzzer. And if the nursing staff or yourselves just spent 5 minutes directing me, you need to take 3 steps forward, Sam, turn 90 degrees. If you take 10 steps forward, you're going to hit the window, but then if you turn 90 degrees left, the bathroom's there, and this is the layout of the bathroom. Do you know how much it would stop me buzzing you when you're also very, very busy? You then go down for an operation, and one of your wonderful doctors comes and talks and explains, this is what you're going to do. Can you sign a consent form? And I signed a consent form. You could have put, I want to have my head amputated. Hope not. I'm signing something that I can't even see. But it's all read out to me, so that's fine, I sign it, and I personally put on there that I'm blind. And then it's fantastic. Get taken down to theatre. The anaesthetist comes around and says, can you confirm this is your signature? No, I can't confirm it's my signature because I can't read it. The communication is so vitally important. I have been in hospital, and I have told you this before, it wasn't your hospital, I could say, when I've had a doctor put his hand down my top to listen to my chest. He didn't tell me. Can you imagine how dilated I felt? So, for someone who is blind, communication is essential. Please tell us everything. If you're going to walk away, tell us, because I won't know if you're going to walk away. I don't know if you're going to walk out the room. I don't know who's standing there with you. You could be there with 10 people surrounding you, and I will not have a clue. So please make sure you communicate with all of us, communicate with us, tell us everything that's going to happen. Make sure you record our records properly, and I'm sure you all intend to, but also ask us, because my knee will be totally different to Annette, will probably be totally different to the next blind person you come across. So just ask us, how can we help you? What can I do to help? Because if, as I came to one of your clinics, I got booked into reception, and the lady said, how can I help you? And I said, I'll need someone to guide me into the room, although I'd normally have a sighted guide with me. That would make it great. It should also be recorded on all my records that I am blind and that I require my information sent to me in email. Oh my goodness me, Shahid, I've rushed through that so quickly because I'm not sure how much time I've got.
That's all right, you're fine. Oh, that's very loud. That's fine. That's fine, Sam.
Yeah, okay, I'll carry it. Well,
all right, and we're going to come back to questions at the end because I'm hoping we've got questions from the audience. And now, Annette, we're going to bring you in. But what I'm going to do, Annette, just before we start, is to play your story, Annette. And this was used as at our board and was used to kind of inform some work we're doing around the HR. So, Annette, I wonder if I could play that and then we can bring you in after that. Dodgy, isn't it? This using YouTube, because an advert will appear about some random thing, and it has. And this lady was probably delighted.
I was born deaf. I was born in 1954. People were unable to diagnose that I had Usher syndrome. The sight loss part of it, which happened in my teens, I had been losing patches of my field of vision, which meant that I bumped into things, I tripped over things, I couldn't see that well in low light. Because my behaviour changed, they didn't diagnose that I had any sight loss, more that I had a mental health need. This meant that I had developed anxiety, I experienced panic attacks, and none of that was ever connected to any sight loss. I did end up with severe depression. It was when I realised I could no longer see to lip read, that I could no longer recognise people's faces, and I kind of withdrew. It was about the impact it had on my everyday life and how was I going to live, how was I going to manage, all those things going around in my head and nobody to talk to. I was always the only deaf child at school. They didn't like the fact that I was deaf. I was told that I would never amount to anything. But when I was 16, I was one of 5 students in my year that got through to the auditions at the Royal Ballet School. I don't know what it is like to hear music, but in a dance studio where you have sprung floorboards, you can feel the vibration of the piano. I could get lost in my dancing. They were very aware that my deafness impacted, and they always spoke more about my deafness, but it was quite clear that I could dance. I was broken-hearted when I gave up, but it was an amazing experience. Live your dream for as long as you can. The biggest thing is the lack of support for deaf-blind people. You feel as though you're more than one person, that you are the person who happens to be deaf-blind. You are the person that happens to not feel worthy, have very low self-esteem, have very low confidence. I was afraid to go out. There is a trigger for me not wanting to go out, in that my second guide dog was very badly attacked by another dog. My guide dog had to be retired. The freedom that I had was just suddenly taken away. People didn't really understand what that meant. When you had worked so hard toward remaining independent, and then suddenly it's all taken away from you. So I felt as though I had to start again, and I did start again. And the best part was when I was assessed as leading a communicator guide. And very, very slowly, my life came back into focus with the help of Marion and people like Marion, who are communicator guides, who give deafblind people the access to the world that we actually need. As a deafblind person, we don't fit into the deaf mainstream services or the blind mainstream services. Without Deafblind UK, it would have been horrendous. They understand about deafblindness, and I think Deafblind UK gives us the confidence and the encouragement to actually tell the world about our achievements. Because Deafblind UK has been a constant in my life, I'm able to live my life in the way that I do. Only in the last 5 years or so, I actually feel as though I'm a lot better than what I was. I've always been a positive person, but the best thing for me is having that support of a communicator guide, knowing that there's an organisation like Deafblind UK. My happiness is having my guide dog Polly and my communicator guide, being able to have those choice and control and being able to make decisions. So I'm in a really good place.
I've got to stop this guy from talking, haven't I? I have done it. Okay. That was very satisfying, actually. Okay, so Annette, I wonder if you want to add, because we've just had your comment and we've watched the video about your questions around communication, and you talk a lot in the video about choices and control. Would you be able to say a little bit more about that?
I'm really sorry. I think my microphone.
No, we can hear you.
Oh, brilliant! It's right. Thank you. I was really worried about that because I spend a lot of time with technology as a deafblind person, but also many of us with sensory loss. With choice and control, it depends on each individual, depending on the background where they come from. People often decisions, and in the end, we forget how to decisions. They have to. And a huge benefit was that after many years of campaigning, we do have a third communicator guide who support. They make the world a bigger and better place for us as well. It means that I can make decisions and have more choice and control over my personal life as well, and particularly within health, because there's a link to having some personal dignity, and that the information is my information, not someone else's. Of course, I want to share it with anybody that I say, but people often get what I would like and how I would like to share. But I think that's really that part isn't. Some people, like I said, make decisions for me, and I said that I really need to try these things out. As I said in my video, don't fit into mainstream services, find mainstream services. So I kind of moved on to technology, and I adapt my technology to meet my own needs, because technology for deaf-blind people is not just hugely expensive, but also it's very hard to get technology purely for deaf-blind people. It does exist, but I've taken that role of my, managing my health needs. It took me a long time, but I think it's absolutely fantastic. When I went to my GP practice, they said, "Oh, you can sign up online, etc." But I really struggled doing that, but I was absolutely determined. I have a communicator guide twice a week. I said to my lovely communicator guide, Marianne, that I would try and set up the online myself, and I spent many hours doing it, but I can't tell you what it meant to me that I was able to do that in the end, and to be able to access my results, the tests, etc., and manage my prescription online has made a huge difference to me. And it's also the same at Moorfield, because we are working very closely with Field Eye Hospital, the expert patient panel, where they have their own digital as well. For somebody who is deaf, we need, there's all kinds of different aspects that we can have. But what I do say to people is that I said it at the beginning, that if I will help them so that you can help me and I can help you to communicate. And I think the overarching theme across all of this, and I'm sure that you all agree, because you made some wonderful comments at the beginning, is that communication is everything to everybody. For many people, we process information so differently as an individual. So, and Shahid was speaking, and this is not a criticism. Shahid would say a sentence, and I would have to think about that sentence before I understood what that sentence was, because it takes me a little while to process, understand the words are being said. So I'm always a little bit behind. So we just need a little bit. That's what's being said to us. I think that it's a very individual thing. I had my fantastic NHS hearing aid, which I Bluetooth, and it wasn't until 2004 when they rolled out hearing aid that my whole changed. My whole world changed because I heard sound I've never been able to hear in my life at all. I didn't know that when you cooking made sounds, all those different things. I could go on forever, but I think, as you said, the overarching thing is communication and how we talk and we treat each other. And yes, I've had not so good experiences with. I've had very good experiences. Well, so is that enough, Shahid, for the moment?
Yes, I think so.
Technology.
Thank you, Annette, and thanks everyone for bearing with us with the sound, because technology can be a great boon, but it can also make things difficult. But you kind of got through it, Annette. So what I'm hoping we've done there is kind of give you a contrast between the use of patient personas and patient stories. Now, granted, Sam Fox and Annette Bodsworth are very unique people. They have incredible knowledge and depth in their experiences, and they have huge courage actually in bringing those stories to us and presenting them to us, because actually that's a very difficult position to put yourself in making yourself as vulnerable as that to present your story. But the reality is that's the kind of work we need to do in order to really dig down into how do we adapt and individualize the care that we're trying to provide. Now, we're going to then we've asked the question, what do you think the benefits are of a patient persona? Now we've watched listened to a couple of patient stories. I want you to get your Mentimeter devices out again, your phones, and tell me what your reflection is about what you think the benefits are of using a patient story. So hopefully the Menti will have moved along, and we'll start to see some responses. And Annette and Sam, I'll read some of them out so that you get a sense of what people are saying. So we've got the first response: clarity and understanding. Improve our care, makes it real. Care and compassion. Better understanding of the barriers. Brings home real examples of how we can deliver better care. It's humbling. It makes you think differently. Good understanding of how it can be for others, to reflect upon the care we provide. Listening is vital. It brings it to life. It allows us to understand the patient side of everything. Understanding of the elements which are not highlighted much in usual practice. Everyone is an individual. So fantastic. We've got 20. We're getting more. Please keep using the Mentimeter. That's fine. We will collect those up and we will share those afterwards. I think what we now want to do is to come on to action. So one of the things that we always think about when we're running these kinds of sessions is a call to action. What are your reflections, having listened to patient stories and patient personas? Which of those will you be trying? So we've got the Mentimeter up on the screen again. Which of those are you interested in taking forward and doing something with? Patient stories, patient personas, or you've got another idea? Okay, great. A lot more votes initially for patient personas. Now they're kind of roughly equal. There is a adventurous individual who said, I have another idea. So we'll have to go and find who that is afterwards. Whoever that was is laughing at this point. Crystal, it's you, isn't it? Okay, fantastic. Oh no, there's much more voting and much faster voting for this because it's probably an easier question to answer. So 16 people are going to be using patient stories, 18. So keep on voting for that. That's fine. So now we're really into the final bit because what we wanted to do was give you an opportunity to ask questions. Now, I know there'll be questions in the chat, which I won't be able to see. So Martin, Ian, Denise, I'm not sure how you're going to pass those on. But one way we can gather those questions is through Mentimeter. So I wonder if you can go on to Mentimeter, and what we'll do is we'll take some questions from the audience, particularly for Annette and Sam, but I'm happy to answer any questions too. So you're very, very fortunate today. You've got two superbly expert people in Annette and Sam. They've navigated the healthcare system for many years and know a lot more than we do sometimes about that side of the world. Faye.
Could I just add to all of you, please don't feel worried about asking us a question thinking you're going to upset us. Annette and I are sort of used to this, and in actual fact, I think Annette would agree with, we both actually welcome whatever questions you have, because more than anything, it shows that you're interested and you want to take out, you want to make changes, which is fantastic. So please ask whatever question you want.
Thanks, Sam. So no silly questions is the message, yeah.
No silly questions.
Yes.
It's extremely powerful.
Okay. All right. So a few people just were saying that our Chief Medical Officer and a few other people have said that they've got to go somewhere, and they said thank you very much. It's been extremely powerful. So there's a question which has come in through the menti.com, and it says, in the hospitals that you have visited, have they had a patient portal? So this is a critical question, and how did it work? Sam or Annette, who wants to take that one?
Can I take that one?
Yeah, go for it.
Okay. I'm a patient at Adam Brooks Hospital, and they do have a patient portal, and I've got to be honest with you, I absolutely love it, because I get an email sent through to me which says you've got a new test result, I can look at my test results, I can look at my appointments, I can see my letters. The patient portal I've got, if that's what you're referring to, is fantastic, providing it works very well. When we done the In Your Shoes event, you know, I spoke to Helen, some of the technology team, and they said sometimes the information, because it was saying, you know, if I had blood taken, who actually took the blood and what sort of cameras they used, whatever it may be. But the patient portal that I use from Adam Brooks is fantastic, and I understand that was set up with patient interaction involvement as well.
Fantastic. Thank you, Sam. Annette, did you want to add to that? Your sound is quite low, Annette. If you can do anything to modify that.
I don't think
That's better.
I just want to say that I use the portal bill, and it makes a huge difference because I cannot receive any letters that are sent to me, read any letters that are sent to me. But on the portal, I have access to appointment letters and all the things that I need. So digital technology means a lot to me.
Fantastic. Thank you very much, Annette. Okay, there's a second question which has come in, which is, what technology do you wish our hospital had in place to support accessible care? Sam, Annette, who wants to take that?
I'll take. Go on, Annette, you go first this time.
I think if I could talk a little bit about, say, home screening, say, for example, like the bowel screening home kit. Nobody ever thought about whether how accessible they are to people living with sensory loss or other disabilities. The information that we got to use them is not accessible to us. On a positive note, because they were not accessible to us, we started talking to the bowel screening people, and now they have a more accessible kit for people with sensory loss. NHS England are running a pilot for 500 blind and partially sighted people who need to use the bowel screening service at home, so that we can just call a number and they will send us the accessible kit. So that the work that we had done had taken a few years, but it has been worth it. It really has made a difference. So, thank you.
For me, in relation to your actual hospital, I have been to, was it the training centre I went to, Shahid?
Yeah.
I'm up there to try and find. So if there was some kind of app where it would recognise where I am and say to me, you know, you need to go 10 metres and then turn right, or wherever it may be. I know Southend Hospital like the back of my hand, but other hospitals I have no idea. And if I get sent, for example, from, I don't know, let's say orthopaedics to X-ray, I have no way of knowing how to get there. So some kind of app where it would direct us how to get from one place to another would be amazing. And even if it go down to the level of in a ward, you know, where the nurse's desk is, things like this, that would be a great start.
Fantastic. Thank you very much, Sam. So Denise has the microphone, and so we can take questions from the audience in the room. Laura's at the back of the room, so.
We've got one question from Helen Howe, who's listening on Teams, so I'll just pose that one. Do either of you use a purple passport or a digital passport to help you navigate through to people caring for you?
So Annette, Sam, do either of you use a digital passport or a purple passport?
No, don't.
So I can either Annette speaking.
Yeah.
I think, can I just add to that?
Yeah.
I think that what you'll find, and I'm 54, 2 years ago I ran the London Marathon. I don't want to be I don't want to be a person who's cared for. I want to be able to live an independent life. So while for some people these may be fantastic, I think we also need to take into consideration that people who are sensory impaired still have the ability if they're given that chance. So that's why I certainly wouldn't use one, or don't have one.
Sam, I didn't know you'd run the London Marathon. That's incredible. Okay. I can see there's one question in the room. Denise, was it from Laura? Okay. Any other questions on the chat?
No questions on the chat.
Okay, fantastic. All right, so thank you very much, everyone. That's the end of the session. But last word should go to Annette and Sam. Annette, Sam, did you want to say anything else before we close?
Yeah, I mean, if I could just say to all of you, please talk to your patient, ask them how you can help them, and specifically record the information and pass that on. So I don't have to tell you and every other nurse that would come and help me, pass that information on, but please make sure you ask every person individually. Thank you.
Thank you, Sam. Annette, any other thoughts from you?
Annette speaking. One of the huge benefits for me is having a communicator guide to support me to medical appointments. I would not be able to access healthcare without having that really valuable support. And it has made a huge difference to my life, how I self-manage my condition. So I also want to leave you with this thought, because I know that it's a really special week for you. It's also Deaf Blind Awareness Week, which is happens every year, and it's in memory of Helen Keller, who was one of the most famous deafblind people that ever lived. So thank you for listening.
Thank you.
Thank you. Let's have a round of applause for Annette and Sam. So Annette and Sam, you got a huge round of applause. Thank you so much for your time, and we'll be in touch.
Have a lovely, enjoy the rest of your day, everyone, and enjoy the heat.
Thank you.
Bye-bye.
Bye.